All right, today we're going to take a road trip, but not just any road trip. We're journeying through the most incredible, complex, and absolutely vital network you own, your circulatory system. We're going to explore what happens when this amazing superhighway starts to develop traffic jams, potholes, and yeah, even catastrophic road failures.
I mean, just look at this map for a second. Can you believe that if you laid out all of your blood vessels end to end, they'd stretch for about 60,000 miles? That is more than twice around the entire Earth. It's just mind-boggling. And this isn't just some passive network. It's a superhighway system that's constantly working, delivering essential supplies like oxygen and nutrients to every single cell and then hauling away all the waste.
And you know, just like any real highway system, you've got two main types of roads. On the left, you have the arterial highways. Think of these as the express lanes, carrying all that oxygen-rich blood away from the heart to the rest of the body. And on the right, you have the venous return routes. These roads handle the crucial job of bringing all the used, deoxygenated blood and metabolic waste back home. And, as we're about to see, things can go wrong on either side of this system.
So let's start with those main delivery routes, the arteries. You know, the most common problem here isn't some sudden, dramatic crash. No, it's more like a slow, creeping traffic jam that just builds up, day by day, over years and years.
And this traffic jam, it actually has a name: atherosclerosis. It's basically a chronic inflammatory condition where these fatty plaques start to build up inside your arteries. Now that might sound kind of simple, but this process right here is the leading cause of death in Western countries. It's the sneaky villain behind most heart attacks and strokes.
So how does this whole mess happen? Well, it all kicks off with some kind of injury to that smooth inner lining of the artery. Think of damage from things like smoking or high blood pressure. So, in response, your body's first responders, these inflammatory cells, they rush to the scene. These cells then start gobbling up fats, or lipids, and they turn into what are called foam cells. And over time, all these fatty cells pile up, creating a plaque that starts to narrow the highway and, you guessed it, restrict the flow of traffic. In this slide right here, this shows what's causing that initial damage. And the major culprits are probably things you've heard of before: smoking, high blood pressure, that's hypertension, high cholesterol, diabetes, and just chronic inflammation in general. These are the things that are roughing up the once pristine surface of our arterial highways.
Now, when those traffic jams from atherosclerosis start happening in the arteries leading down to your arms and legs, it gets its own name: peripheral artery disease, or PAD. This can cause all sorts of problems, from pain when you're walking to, in the really severe cases, ulcers and even gangrene, all because those tissues just aren't getting the blood supply they desperately need.
But you know, arterial problems aren't always about slow-moving traffic. Sometimes the road itself just fails, suddenly, catastrophically, and that leads to some really acute emergencies.
First up is an aneurysm. The best way to think of this is like a dangerous pothole or a really weak spot in the highway's foundation that just starts to bulge outwards, all because of the constant pressure of blood flowing through it. And what causes this weakening? Often, it's the same old culprits: atherosclerosis and high blood pressure.
Now, what's really important to see here is how the entire wall, all three layers of it, balloons out. The real danger here is rupture. As that aneurysm gets bigger and bigger, the wall gets thinner and weaker, and the risk of a total blowout just increases dramatically, especially once it grows beyond 5 centimeters.
Then there's an even more dramatic failure: an aortic dissection. Okay, this isn't just a bulge. As this quote explains, this is when the inner layer of the aorta actually tears. Blood then just surges right through that tear, forcing the layers of the artery wall apart and creating this new, false channel for blood to flow through. It's terrifying.
And these dissections get classified based on where that tear happens. Type A is the most dangerous one. It involves the ascending aorta, right as it curves up and out of the heart. Type B involves the part of the aorta that runs down through the chest and abdomen. And I gotta say, uncontrolled hypertension is a massive risk factor for this devastating event. And finally, on the arterial side, you can have a sudden, complete roadblock, what's called an acute arterial occlusion. This is a true emergency, and clinicians look for these classic 7 Ps. A pistol-shot sudden onset of extreme pain. The limb becomes pale or pallor. It's polar, meaning cold. There's pulselessness, and then you get paresthesia or numbness, which can quickly lead to paralysis. This is absolutely a limb and life-threatening event.
Okay, let's take a deep breath. We've covered the delivery highways, but what about those return routes?
The venous system has its own unique set of problems where the issue usually isn't high pressure, but the challenge of getting blood all the way back to the heart, fighting against gravity.
A super common issue here is varicose veins. You see, your veins have these really clever one-way valves to keep blood moving upward. But when these valves fail or become incompetent, blood flows backward and starts to pool. That pooling causes the veins to stretch out and become dilated and all twisted up. Major risk factors are things like age, pregnancy, and having a job where you're standing all day long.
But a much more dangerous problem on the return trip is deep vein thrombosis, or DVT. This is when a blood clot, also called a thrombus, forms in one of the large, deep veins, and it's usually in the leg. This clot right here is going to be the central danger in our next few slides.
So what causes these dangerous clots to form? Well, it usually comes down to a classic concept in medicine known as Virchow's triad. It has 3 parts. First, there's stasis, which is just when blood isn't moving well. Think about being stuck on a long flight. Then there's hypercoagulability, which is a fancy way of saying your blood is just stickier and more prone to clotting. And finally, there's endothelial injury, or damage to the veins lining, maybe from a surgery or some kind of trauma.
Now, having a clot just sitting there in a deep leg vein is a problem, for sure, but the real life-threatening danger, that comes when a piece of that clot breaks off and starts to travel on the superhighway.
So what do you think happens? That piece of clot is now what we call an embolus. It's a traveler, and it's heading directly toward the heart and the lungs, riding that venous return route like a freight train.
And here is its final destination, the lungs. This is a pulmonary embolism, or a PE. The clot travels all the way from the leg, up through the right side of the heart, and then it gets stuck in the arteries of the lungs, creating a sudden and absolutely critical blockage. It's a traffic jam from the venous system, causing a massive roadblock in the pulmonary system.
And this isn't just a breathing problem. A massive PE blocks blood flow so severely that it puts this immense strain on the right side of your heart, which can actually fail. This kicks off a vicious cycle where the heart can't pump enough blood, leading to shock and death. In fact, PE is responsible for a huge number of in-hospital deaths.
Okay, let's just quickly summarize our whole journey. On the arterial highway, we saw those slow buildups like atherosclerosis and the catastrophic failures like aneurysms. And then on the venous return routes, we saw the problems with flow, like varicose veins, and that really dangerous sequence of a DVT leading to a pulmonary embolism.
So, we've seen how this incredible 60,000-mile highway can break down, from those slow, creeping traffic jams to the sudden, catastrophic failures. The final question, then, is really a personal one. Knowing all the risks, how are you going to maintain your own roads for the long journey ahead?